be infected with the virus or one of its variants again. COVID-19 can cause severe illness or death, and we can't predict who will have mild or severe cases. Some people continue to have long-term health issues from COVID-19, even with mild cases. You can also spread the virus to others, including your family, even if you don't have symptoms. Vaccination is the safest path toward building a community of immunity, even if you've already had COVID-19. Thanks for tuning in. I'm Anitra Ellis, and I recommend the COVID-19 vaccination to my patients, family, and friends. For more information about COVID-19 vaccines or to find a vaccination location near you, visit Vaccinate.wv.gov.
Hi, I'm Dr. Allison Lastinger. I am a physician specializing in infectious diseases and medical ethics at West Virginia University. I've taken care of many patients with COVID-19 infection. Sometimes people ask me if the benefits of COVID-19 vaccination outweigh any risks of the vaccine. This is the primary question that leading public health and medical experts thoroughly examine as they consider authorizing and using new vaccines. In fact, the FDA only authorizes or approves vaccines that have undergone intensive clinical trials and were found to be safe and effective. This is certainly true for the COVID-19 vaccines, where the benefits such as significant protection against severe disease and death far outweigh the risks of vaccination, which can include minimal short-term side effects and serious but very rare side effects for a small number of people. The risks of vaccination are smaller than the risk of COVID-19 infection itself. The vaccines have proven themselves to be highly effective in preventing severe illness, hospitalization, and death from COVID-19. They are also demonstrating effectiveness against new variants. The COVID-19 vaccines play an important role in protecting you and those around you, including our most vulnerable and those who cannot yet be vaccinated, such as young children. Because there are substantial benefits of the COVID-19 vaccination, I got vaccinated and recommend COVID-19 vaccination to my patients. Thanks for tuning in. I'm Dr. Allison Lastinger. For more information about COVID-19 vaccines or to find a location near you, visit Vaccinate.wv.gov.
Hi, I'm Dr. Rebecca Reese. I'm a physician and infectious disease expert in West Virginia. Throughout the pandemic, I have cared for many patients with COVID-19, and I've led research on COVID-19. We are hearing a lot about COVID-19 variants, and naturally there are questions about what they are and if the vaccines are effective at protecting against them. Viruses constantly change through mutation, creating new variants or strains over time. Sometimes new variants emerge and disappear, other times new variants emerge and stay. Multiple variants of the virus that causes COVID-19 have been found in the United States and around the world during this pandemic. These variants are slightly different from the past strains, and they can even infect people who had COVID-19 before. Scientists continue to study these variants. For example, they are looking to see how easily they spread, the severity of the disease they cause, and how well the vaccines work against them. Ongoing studies have found that the COVID-19 vaccines can help prevent severe disease, hospitalization, and death from the variants. Areas with low vaccination rates are more vulnerable to the virus transforming, potentially becoming more contagious and severe. Large portions of our communities getting vaccinated helps create a firewall against the virus, preventing the virus from spreading and changing. The faster we get vaccinated, the faster we can build a community of immunity against the virus and its variants. Protecting our community from variants is one of the reasons that I chose to get the COVID-19 vaccine and why I recommend it to others. Thanks for tuning in. I'm Dr. Rebecca Reese. For more information about COVID-19 vaccines or to find a location near you, visit Vaccinate.wv.gov.
Hello, everyone. It's Monday, August the 2nd. Regretfully, over the weekend, we had 5 additional deaths. We still continue to trend in a good way. We're very concerned about this Delta variant, and I'll get into that in just a second. But let's pay all of our respects to these great 5 West Virginians that we've lost, and all their loved ones, their families especially. But the 2,945th death is a 64-year-old male from Brooke County. The 2,946th death is a 42-year-old male from Mason County. Good gracious, 42. The 2,947th death is an 85-year-old male from Fayette County. The 2,948th death is a 78-year-old male from Lewis County. And the 2,949th death in West Virginia is a 78-year-old female from Logan County. Again, I say it over and over and over. You can't let these people just become a number. I mean, these are real great West Virginians that we're losing, and we've lost 2,949. So please keep them in your prayers. And if you know these people, know these families, call them. At least call them and tell them that you hate like crazy their loss, and you're just want them to know that they're not alone. We have 665 new cases since our last update. Our daily positivity rate is at 6.41. Our cumulative rate is at 4.93. Now get this, we dropped below 1,000 active cases. Now we are at 2,480 active cases. We're up 570 active cases since the last briefing. Our recovered cases remain just about the same, slightly higher, 162,000. We now have 152 people hospitalized in West Virginia, and 67 of them are in the ICU units. We have 2 red counties now, 5 orange, 10 gold, 2 yellow. You know, you can see clearly that all of our green map has just flat gone away. Now, before I go any further, let me just jump to this. You know, you listen to General Hoyer, and you listen to Dr. Marsh and Dr. Amjad, and you listen to Secretary Crouch, you listen to me. We don't come to you screaming wolf, wolf, wolf about, you know, everything that comes along. But when we speak, and especially those, when they speak, and when they tell me, and then I speak to you about the fact that we're concerned, and we should all in West Virginia have some level of concern about this Delta variant, it could very well be something that would be really bad. And we do know how to stop it. And the way to stop it is just be vaccinated. You know, and we'll get into it just a little bit more, but the main thing is just this. When we come to you and we tell you something, we're not telling you that just fly by night to scream wolf about anything. We don't do that. We've never done that. And we hope and pray that really and truly if we raise your level of concern and this thing goes away, what have we lost? Nothing. We've lost nothing. But if we don't raise your level of concern and it eats us alive, we've lost a lot. Now, before I go any further, we've got some really nice news here and everything about the economics of our state. I have said it all along that you know, not only do you need a governor that'll shepherd you through the really storms that we've had in regard to COVID, and he'll come out here and tell you the truth and take the press's questions no matter what they ask. You need that because you need to have the faith that somebody's going to tell you the truth, not inflate it, not deflate it, not hide anything from you. You know, But also, we need to watch the store, don't we? We need to mind the economics of who we are and what is going on within our state. Now, we've done that, and we've produced surplus after surplus in really trying and difficult times. Now, last July, we started July off with a negative number, and then August followed, and then, I'm sorry, maybe that was July before last, but we started off with a tremendously negative number, and then all of a sudden August chimed in and we were $62 million to the bad. This July, we just started off and concluded July 28.1 million above surplus. Our personal income tax collections were 14.7% above estimate. Our severance tax, and this I love this to death, because this is coal miners going back to work. This is our gas people working and everything. Now I'll probably get in a little bit of trouble by saying this and everything from the standpoint of the oil and gas and the coal people, but just think, I came to you on the State of the State address and said we should tier the severance tax on coal and gas. Only in the really best times, are we going to ask those companies to pay a little teeny bit more. We didn't do it. And coal prices are up and gas prices are really up, and maybe it could have helped us a little bit more. But the severance taxes grew by 95.8% above last year in the month of July. 95.8% increase above last year in the month of July. Now, I really, truly believe with all my heart, it just tickles me absolutely to death. I believed when I stood before you in the State of the State, why would I have said tier the severance tax on oil and gas and coal if I didn't really believe that we were going to see a real uptick in the markets on these, when everybody said, oh, coal's dead, it's never going to come back, coal's dead as it can be, and oil and gas, same thing, dead. And lo and behold, 95.8% increase over last year in the month of July. Our corporate net income tax, we're 5.6% above, and the net of the whole thing, a great month, great work by all of our revenue folks, and especially, Dave and Mark and Mike and everybody. I really appreciate all that you're doing. And this was our first month in fiscal year 2022. So this is the first month we started with a 28.1% surplus and or $1 million surplus, and we're just gonna keep on rolling. 28.1 million surplus in the month of July. I hear all the time we do not have any, and nor do I plan at this point in time. The face mask mandatory, stance from my end. But I would tell you just this, that if you're older than 65 and you have a concern, and you probably should have a concern if you have any illnesses or you're overweight or whatever it may be, but you have risk factors. Well, you know what your risk factors are. If you're feeling a little bit bad, you've got COPD, you've got diabetes, you're overweight, whatever. But if you're that and over 65, you may want to consider, and it's your choice. It's your choice wholeheartedly. Even if you've been vaccinated, you surely may want to consider, if you're in a large crowd or large gathering, you may want to think about wearing a mask. But let me just say this. Now think about this just a second. Now, West Virginia, you're smart people. You're really, really smart folks. And you've got good instincts and good common sense, and you can talk to you and you can tell you the truth. I'm really proud of the fact that I am a true blue West Virginian, and so with all that being said, let's just step back and think about this. You're just weeks away from a WVU football game, or a Marshall football game. You're weeks away, very short weeks away from fairs and festivals. You're a couple of weeks away from the West Virginia State Fair. And people are going to be piled up on top of people. Now, you know this Delta variant is there. Now, how are you going to feel walking through those crowds and not being vaccinated? You know, really and truly, are you not going to have some level of real anxiety or concern? You know, if you haven't been vaccinated, whether you're a kid or you're a 70-year-old, you know, that has all kinds of issues, or no matter who, how are you going to feel? I mean, should you not really think really hard about being vaccinated? You've got our coronavirus czar that's telling you this Delta variant is, people, when they're talking, are spewing out 1,000 to 1,400 times the virus that people were doing with the COVID thing. You know, so you have an incredible chance, if you haven't been vaccinated, not a kind of chance, you have an incredible chance. If you're walking around at the state fair with people jammed together, or you're walking around at a WVU football game and people jammed together, you have an incredible chance, if you haven't been vaccinated, of really having a problem. And so, absolutely, I want you to enjoy the state fair. I want you to enjoy the football games, and absolutely, I am not mandating anything at all, but you really need to think about that. That's all there is to it. Last Thursday, we launched the Booster Battlefield Assessment. And this is the first statewide program in the country to test and measure antibody levels. And what we're going to do, we're going to move as quickly as we possibly can to go to our nursing homes, or on a voluntary basis, anybody that's age 60 and above that absolutely wants to get their antibodies tested and everything. And then we're going to share all that information with all the folks, with CDC and FDA and all those people. We're going to share the information we have in moving towards what we believe is going to come out and be, you know, where people 60 and older, you know, that need a booster shot with their antibodies at a certain level, you know, or lower, you know, that those booster shots are going to become available. We're going to work with WVU and Marshall to lead this study with the help of DHHR. We're also working closely with the WVU Healthcare Network or Association. And I'm going to read this part to you. We're in the process of connecting with FDA, CDC, and the vaccine manufacturers to make sure we are providing this real-world data in a way that assists in determining if a third dose of vaccine is best for our citizens over 60 who have had their first vaccine and it's 6 months old and everything. And exactly, it is almost a duplicate of what Israel's doing. So if you're 60 and older and you had the vaccine 6 months ago or more, we want you to come and stand up and get tested for your antibodies. And at that point in time, we're going to provide all that data to all these folks across the nation, the first state to do so. And as we provide that data, then I feel like what we'll do is we'll come back to you and say, if you're 60 and older and you've had your vaccine 6 months ago and your antibodies are at a level, and let me just say, you know, they're at a level of 50% or lower, then you need a booster shot. But that's what we're working on right now. And like I said, West Virginia's led the way and led the way and led the way. Little old West Virginia got some really smart people here that are doing a lot of really good work. And so I congratulate you, and I urge you, like I said, if you're 60 and older, you know, think really hard about helping us out. and getting your antibodies tested, and we're going to work with the nursing homes as well. And in fact, I told you the other day that I was going to get mine done that day, and I don't know what happened, but some way it got, messed up and everything to where we couldn't get it done that day and everything, and I think that was on Thursday, and so, but I'm getting it done today for sure, absolutely for sure. Okay, right now, in the state of West Virginia, we now have the Delta variant in 29 counties. Berkeley County has the most. We're continuing to watch it all over the place. This particular variant, is our young people are it attacks our young people pretty significantly, where before the COVID, virus or disease, was more prevalent in our older people. It's critical to get vaccinated as quickly as you possibly can. I'll never forget this. I'll never forget Dr. Marsh or someone said, so many people, I think it was another doctor, I'm sorry, but said so many people that are in the ICU units or wherever they may be, and they've got this. They have asked the doctors over and over, can I get my vaccine now? And the doctors look at them and say, no, it's too late. So don't be too late. Don't be too late. Get your vaccine, and not only will it make you feel better and put you at ease, but it'll put your family at ease, all your loved ones at ease, and it'll absolutely make it to where you are really part of the solution. You're part of the solution to get this thing dead and killed and gone forever. Okay, good news on the vaccines. Over the weekend we had an increase. Well, we actually got 7,500 people were vaccinated since last Friday. That's great news. That's way, way, way up from where we were before. And I congratulate those that are hustling to get their vaccine. That's good stuff. We're at 89.5, unbelievable number, 89.5% right now of the folks that are 65 and older that have had one dose, 82.5% of those 50 and older. We're at 68.3% of the total population, which is 12 and older, that are eligible, so that's really great. And we have now got a first dose, at least one dose rather, in 1,064,697 arms of West Virginians. Good stuff, good stuff. Think about this, I don't know exactly what this number is, but remember we started out, that at the time that 588,000, but that 588,000, included, was down to the age of 16. And 16 and older, those folks in the state of West Virginia, I can't recall exactly what it was, but let's just say that 16 and under 16 and under in the state of West Virginia were 400,000 people. Well, if we had 1.8 million total, and you take 400,000 away, because those people couldn't even get the shot. They could not get the shot at that time. So 16 and under, 400,000. Take that away from 1.8 million, and that left 1,400,000. And that's how we calculated. We must have been at 850,000 people or whatever, and we came up with a number, 850,000 people. And we came up to a number that said we want to beat 588,000 that we didn't get vaccinated. That's what we did. That's how we did it. Of the eligible people, we wanted to beat 588,000. Well, now just think about this just a second. Now we've added from 16 down to 12. And we probably picked up, I'm just going to guess, 200,000. Okay, so in that situation, now the only people that we're not vaccinating are 12 and under. Well, how many of those are there in West Virginia? How many of those people are there in West Virginia today? You know, if that number is 250,000, you add that to the 12, that's 200,000, that's 450,000. You take that away and you look and you've got a total number of 1,064,000 that have been vaccinated. When you put that all together, you are so significantly below 588,000, it's unbelievable. And so we're doing better. We're doing a lot better. And I know that math is confusing, but we're doing lots better. From the standpoint of vaccine eligibility and your second shot, you know all this stuff. Got to get your second shot. Vaccine eligibility 12 and above. Vaccines are tremendously effective. The young people, out there still are lagging behind, but you're doing better. Help us get those young people vaccinated. You're getting ready to go back to school. I mean, come on, get vaccinated. From the standpoint of COVID information, it's up there. From the standpoint of our sweepstakes, we're going to move this now till Thursday. This will be our last drawing, and to do it for baby dog stuff, I'll try to bring baby dog with me on the Wednesday briefing and everything, so everybody can see her, and then we'll go out on Thursday and give away these last prizes and everything. And I don't know what we'll come up with next as far as the marketing, but please, come on, you got to get vaccinated, and if you hurry up, you'll be able to be in this last drawing. We're going to give away 2 cash prizes, one of them $1,588,000 and another one $588,000 in second place. So get yourself vaccinated and get yourself registered, and who knows, baby dog and I may show up, and that'd be great stuff. You'll have until let me think now. Is that right on the day? So you got to hurry. I mean, today is your last day to get vaccinated and get registered to be eligible for that drawing. Okay. From the standpoint of testing, it's all free, and we thank Fruth and we thank Walgreens for all that they've done, and so hurry. If you have any kind of symptom whatsoever, you've got to go get tested. Long-term care facilities, we have 5 outbreaks there. We have 10 in our church communities in 9 counties. That's Braxton, Cabell, Fayette, Jackson, Jefferson, Marion, McDowell, Nicholas, and Putnam County. We have absolutely been so far below that, it's unbelievable. That you've got to really be on your game in the church community, because that is an area where we're singing and we're together, and it's the greatest of the greatest. I get every bit of that and everything, but we got to really watch, because this thing can really go in our church communities. Corrections, we have 2 inmates and 2 staff cases. It can't be better than that, and I encourage you about giving blood. But that's all I got right now. Thank you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning, and I think the governor has said it very well. Certainly, as we are watching the Delta variant grow and the percent of new cases of COVID-19 that we're seeing in West Virginia, it is the same for our country. And I think it's really important to be really clear, and as the governor said, speak in plain and clear language. There's a lot of information that is evolving, and there's a lot of different numbers that can confuse people. But let me just try to be really clear. So the Delta variant is different than any variant that we've seen of COVID-19. It can spread as quickly as chickenpox. It can spread through contaminated air, like breathing in cigarette smoke. It can occur outside as opposed to what we said before, inside. It does appear that people that are fully vaccinated, though, are incredibly protected against the severe consequences of COVID-19, including the Delta variant. And that's particularly important for people that are fully vaccinated with either Pfizer or Moderna and are 2 weeks after their last dose. There was a big outbreak in Massachusetts, which the CDC reviewed, and that changed some of their guidances, where 469 people in in a small town called Provincetown, which is a beach destination in the Cape Cod area, all tested positive for COVID-19, and 3/4 of those people were fully vaccinated. And what they found is when they sampled the airways of these people, that they had basically about the same amount of virus in their nose and their airways. And that suggested that people that were fully vaccinated may be able to infect other people with COVID-19, just like people that were not vaccinated. But the big difference, and I want to make sure this is clear, the big difference is almost nobody got sick. 5 people of that 469 people got ill, and nobody ended up dying, and nobody went to the ICU. So the vaccines are incredibly effective in preventing the most severe side effects, consequences of COVID-19, prevents hospitalization, prevents ICU admissions, prevents deaths at over a 90% level. Now, what's also notable is that COVID-19, as it's going around the United States, it's causing a lot of people to get sick. Our hospital numbers are picking way up, but over 90% of people that need to be hospitalized with COVID-19 today in the United States are not vaccinated. And when we look at our breakthrough rate, in other words, how many people who are fully vaccinated in West Virginia have gotten new infections, we find that number, at least at last measure, at about 0.1%. So these vaccines are incredibly effective. And with all the information out there, I think it's important that each West Virginian who's not vaccinated understand this risk. This form of COVID spreads faster than any other. In the state of Florida, they had more infections, more new infections on Friday than they've had at any other point in the pandemic, and their hospitals are full. And the people in the hospitals are getting younger because the people that have been fully vaccinated are elders, our nursing home population, our immunocompromised people, our people with coexisting medical problems. They are not getting sick enough to go to the hospital. But it is important that people do pay attention, because this virus can spread easier than previous forms of COVID-19 by a lot, as the governor said. And so it is reasonable, in my opinion, for people who are in high risk groups or people that are just worried and want to stay healthy to really consider wearing masks, because we know that in situations like healthcare where people wear masks, we're not seeing those outbreaks. And so masks still seem to be effective in doing the other protective things, keeping your distance, washing your hands, don't go out when you're sick, avoid huge crowds, and that's avoid huge crowds indoors or outdoors. And if you need to go there, then I would be considering wearing a mask if you have anything that puts you at risk of having more severe disease. This is a really important moment, and I know that there's a lot of different concerns out there. But in places like Arkansas and Alabama and in West Virginia, people are hearing that message. And in Arkansas and Alabama, they've doubled the number of daily vaccines they've been giving recently, because people are becoming more aware that this variant can cause harm to people that are not vaccinated. And people who get it can start to spread earlier, even if they're asymptomatic. As the governor said, concentrations in the droplets of people cough or sneeze or talk or yell who are infected with COVID-19 may be 1,000 times more virus in those droplets and aerosols, which gives you a higher risk of being infected. And if you're not vaccinated, a higher risk of getting really sick and maybe dying from this. Thank you.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Again, would like to highlight a couple of items that the governor pointed out. We did have a solid weekend of vaccinations, 7,500 vaccines since Friday. But as the governor pointed out, still unfortunately not fast enough in West Virginia. We need to pick up the pace. And I'll just highlight a couple of things. You know, the governor pointed out the increase in the number of cases overall. We looked this morning at the R value, that transmission rate that for these 504 days. We've pushed to keep under 1, is now 1.67 and moving rapidly towards 2, twice the level of where we need it to be. And as the governor pointed out, the map is changing significantly. The other thing I'd point out, just to understand the speed with which this is moving, the governor from the dashboard announced 152 hospitalizations. Since we've been on this press conference, we've received an update from the Hospital Association for this morning, now up to 178 already. So West Virginia, we've got to get on it. We've got to get vaccinated so that we can do our part, both here for the citizens, but also nationally to stem the tide of this. A couple other items to point out. A couple of weeks ago, the governor announced great news that we had landed a technology company, Data Robot, which does artificial intelligence and trend data analytics. Data Robot will be supporting us starting later this week with modeling and trends and trend analysis so that we can get a better picture of the speed with which the Delta variant is moving and how vaccines would impact slowing the speed of that spread. In addition to that, the governor pointed out nursing home antibody testing would be first. A lot of work going on behind the scenes, DHHR, the Interagency Task Force, WVU, Marshall, to get all the logistics in place to work that, working closely with the West Virginia Healthcare Association. We will continue to keep you updated. People need to be patient as we put this process in place. It will take us some time to work through that. Thank you.
All right, thank you, sir. Dr. Ayn Amjad and Secretary Bill Crouch are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. I had a couple of questions about our booster initiative, our Battlefield Booster Initiative. So first of all, are people able to already register for this program? We've already gotten a couple of calls from people that are looking to volunteer. Is there a way for people to do that as of yet? Do we have a timeline for how long it'll take this to get started and how long we think it'll take to complete? And how is this being funded? Are we using our federal COVID dollars to fund this? Has there been any word about the manufacturers reimbursing us for the cost of it? Thank you.
General Hoyer, I think you've got to answer this, sir.
Yes, sir, Governor, and I'll ask Secretary Crouch and Dr. Amjad to help as well. So, Charles, we would encourage folks to go ahead and call our hotline and those who are interested in being a part of this so that we can gather that information. It is going to take us some time to get started with the nursing homes and the assisted living facilities first. And then as the WVU and Marshall team working with the DHHR lab are able to ramp up the speed to draw, that will accelerate. The good news is, as part of our initiative early on that the governor authorized us to do on testing, we do have a significant number of antibody test kits that we have already built. And I'll let Secretary Crouch cover any additional things that are important from a DHHR standpoint funding.
Yeah, thank you, Charles. We are working with WVU and Marshall to get this started immediately. We should be drawing samples within the next couple of days. In terms of funding, we're looking at various funding sources. We have a contract underway right now that we're preparing that we can move through the system very quickly. We will make that a priority of everything we're doing right now. The funding for this, we're looking at a couple of options, but we will probably fund this through state funds because it's a research project. CDC, you have to go through an elaborate process to be able to use federal funding for that. We have state funds that we think we can make available to do this. The point on all of this is we're going to move as quickly as possible to make this happen and get folks beginning with nursing home population, samples drawn and tests being run so that we can move quickly on this. Thank you, Charles.
To me, just want to say, Charles, in addition to this, we are in contact with the manufacturers. We are going to have conversations with them. We're already talking with them and everything, but about them picking up the tab as well. But we feel like that we've got the monies to be able to move forward, and then we'll also try to tap into the manufacturers as well.
All right, thanks, Charles. Next to Kenny Bass with WCHS and Fox 11.
Thank you for taking the question. I have a question for Dr. Marsh. It's going to get into the weeds a little bit, Dr. Marsh, and I am not a physician nor an epidemiologist, but I have some questions that I think could maybe shore up or at least illustrate why there's still some hesitancy and still some uncertainty about exactly what's going on with the Delta variant. The first thing would be the claims from the CDC that there's just as much of the material in the nose passages of vaccinated people who have a breakthrough as there are with people who are unvaccinated. And while it's true, still the vast majority of people who are vaccinated don't get this thing. It's 60-some%, I still think, or 63%. So without that other nugget of information that the amount of infectious material in your nose, if you've had a vaccine, is because of a breakthrough, I think that helps contextualize it a little bit. The second thing is this Provincetown study that's been put out is, to my knowledge, the only study that the CDC is using to base its latest recommendations on. And Provincetown is very much like a spring break community where there's a lot of bars and restaurants. So liken it to a Morgantown on a Friday night or over a weekend, where we saw a more robust spreading of the coronavirus early in the pandemic. So that may skew the numbers. And finally, the India study that's being quoted by some healthcare experts, number one, was retracted after it was put out and is yet to be validated. So with those three things that are combining together, and I'm not saying that the Delta variant isn't dangerous and people shouldn't be vaccinated, but that is fueling some people's hesitancy that we're only getting drips and drabs of the news instead of getting the entire picture to help people make the decision for themselves. Is there any validity to that?
Dr. Marsh, please.
Thank you, Governor, and thank you, Kenny. Kenny, I think that that your very well put three questions are what I was trying to address better in my first comment. So it turns out that these vaccines, and this just came out from the CDC, looking across, I think, 20 states that were measuring this, these vaccines are 99.9% effective in preventing any breakthroughs. So when you look at our state, we have a 0.1%. Some states go as high as 0.9% and go down as low as 0.02 or 3%. So ultimately, these vaccines are incredibly protective. And I think that's important, number one. Number two is because these vaccines are given systemically in the arm versus given up the nose, then the virus that might be present in the airway may be expected to not be as suppressed by the vaccines as the amount of virus that can get into the blood and get into the cells of our body to gain entry. And so some thought is that the reason why there may not be as much difference or no difference between the respiratory content of people fully vaccinated versus non-vaccinated who become infected is because the vaccines really weren't designed to reduce the nasal carriage or the respiratory carriage. They really were designed to prevent severe, complications, hospitalizations, which is the way that most vaccines work. And so in that way, then again, data from CDC says only 0.1% are viral breakthroughs and are vaccine breakthroughs. So therefore, a really small percent of all people getting vaccinated will get reinfected. If you get reinfected, though, the amount of virus in your nose is as they found the same with the Delta variant and vaccinated, non-vaccinated people. So the concern about the spread from fully vaccinated people exists, which really was the driver of the mask recommendation. When it comes to Provincetown, you're exactly right. It's a a beach town, and there was tremendous numbers of close contacts between people. And the number has risen up well over 800 now of people that were infected in that time period, which was the July 4th time period. When it comes to the India study, there's many studies from India. I think the most important finding from India was, like in Great Britain or the UK and in Israel, that all got really hit hard with the Delta variant, that you see a really rapid surge in cases, much more explosive and faster than we have seen at any other point in the pandemic, including people getting sick. So we can pretty much count that when the Delta variant really takes hold here, we are likely to see a much faster time frame of people getting sick with the Delta variant, and in the unvaccinated, people that might get very sick with the Delta variant, and younger people are impacted because this variant can infect young people just like older people, and many older people are fully vaccinated. But it goes up quickly, and then it sort of plateaus for a little bit, and then it seems to come back down pretty quickly. And in India, they found that about 2/3 of the population tested positive for COVID, of 1.3 billion people. So the presumption is that part of that is that the Delta variant goes through the population really quickly, spreads quickly. We've talked about spreading like chickenpox. And lots of people died in India that was very poorly vaccinated. Whereas if you look at the UK and Israel, they also saw a rapid upswing, but didn't see nearly the number of deaths. Deaths in both Israel and the UK were really, really low, even though the cases went up and some people ended up in the hospital, again, sort of reconfirming the benefit of full vaccination. And I'm blocking on the number 2 question you had, Kenny, but I hope that helps.
All right, thank you, Kenny. Next, we'll go to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Perhaps this one is for Dr. Amjad. It goes to contact tracing. Do we still have the same amount of contact tracers out there that we had during the height of the pandemic? And has the Delta variant revealed anything as far as that contact tracing goes in West Virginia? Thank you.
Okay, Dr. Amjad.
We do have the same amount of contact tracers, Paul, so that hasn't changed. We've been able to hire some staff as well, so that hasn't changed at all. To answer your second question, we do have some information. As far as the Delta variant goes, a lot of the patients that have the Delta variant were unvaccinated, so that's one thing in common. A lot of the contacts of those as well are in the same household, so that's something else in common with that. And also some of the patients who had the Delta variant traveled out of state. But those are some things in common with that. So close household contacts, as well as traveling out of state, were things in common with the Delta variant. But those are the things for your questions. Thanks.
All right, thanks, Paul. Next to Mark Curtis with Nexstar Media.
Good morning, folks. I missed the top of the briefing, and maybe you addressed this, but in the event that I didn't, maybe you can. Of the 665 new cases since Friday, do we know how many are Delta variants? Do we have a Delta variant total upgraded from the 100 on Thursday? And I'm wondering, I don't want to add to anyone's workload. You're all working double time on this anyway, but I'm wondering if we can get Delta numbers to come out Monday, Wednesday, and Friday so they coincide with the briefing so we can get some context. I know the other day you said there were 78% of all new cases were Delta variants. If that was the case, 518 of the new cases since Friday would be Delta variants. And the other part of my question is, you say it's in 29 counties. Where is it the worst? I know Berkeley and Monongalia, given their proximity to big cities, were bad. But if you could kind of update us on that.
Okay, Secretary Crouch, maybe you can help out a little bit here, and Dr. Amjad, you can chime in as well and help.
Yes, thank you, Governor, and thank you, Mark. The sequencing for the variant is not as simple as it sounds. So let me try to explain that very briefly. When we get a positive case, if those individuals are breakthrough cases, we sequence all of those. We also sequence folks who have been out of state, out of the country, or a variety of reasons where they might be a little more susceptible to the Delta variant. that takes, to the time we get the sample to the lab, and WVU is doing most of these, and we again appreciate their help so much, that they're speeding that up as quickly as they can, but it takes in the neighborhood of a week to get that test done once the sample is received. So by the time we get that, and it can take longer, up to 10 days to 2 weeks. So by the time we get that result back, that individual who has tested positive for the Delta variant is likely through their course of disease. So they may be back at work at that point. So this is a situation where we're looking at this information. It's very beneficial to us to make decisions going forward, but it's not actionable public health information that we use. So we can update those. We're trying to update those more quickly, but it's a very labor-intensive process to do that. So, but we'll look at that and see if we can't update those even faster than once a week. So thank you for the question, Mark. Was there another part of that question? I'm sorry.
Yes, I was curious about the 29 counties that we have it in now. That's over half the counties in the state. Where is it the worst? And what is that telling us?
Well, the information on variants is by county, and it only shows 100 right now, as you mentioned. So we will update that as fast as we can update it. We're doing it once a week right now because it again is very labor intensive from a staff standpoint. But the fact that we have 100 right now means we probably have 1,000. We probably have 2,000. We don't know what the general population, what the numbers are in the general population. What we know is what we've sequenced from those individuals who have been positive. So we really have no way to determine of that 665, how many would be the Delta variant.
Mark, you missed this. Berkeley County right now, we feel like is for sure the leading county, but we can maybe get you some more information on that as well.
All right, thank you, Mark. Next to Steve Adams with Ogden Newspapers.
Steve Adams with Ogden Newspapers here. I was going to ask a similar question to Kenny. I feel like that got addressed pretty well, both in your opening remarks, Dr. Marsh, and with the follow-up from Kenny. But I do kind of want to ask about perception. It seems to me, based on everything I've read about the CDC, the study, these slides that got leaked, basically all of their handling of it since the middle of last week, at least in my mind, seems to really kind of hurt and probably set back the effort of trying to get people vaccinated by over exaggerating, based on the data I've seen, the ability of vaccinated people to spread the virus around. And I mean, I just looked at a Kaiser Foundation report that just came out a little bit ago that showed that the hospitalization rate among several of the states was near zero, if not, double zero percentages. I think 0.06% in Arkansas was the largest for hospitalization, and then the rate was even lower for deaths in regards to breakthrough cases. So are we concerned that the way the federal government has handled this and did their mask recommendation and everything that has happened over the last couple of days, are we concerned about the way the federal government is handling the messaging on this? And do we think it's going to set back vaccination? Thank you.
Dr. Marsh, the only thing, Stephen, I would add is just look at our numbers just a second. If you just look at our numbers, our active cases have gone from less than 1,000 to 2,480 cases. And our hospitalizations, we dipped below significantly under 100. We're at 152. And look at our map, of all of our counties, and how that they're turning away from the green into the red and yellow and orange and gold. So Dr. Marsh, maybe you take it from there. You're surely the expert on this and not I.
Thank you, Governor, and thank you, Stephen. I think that we're now starting to get into, I think, so much confusion because of so many statistics and numbers. But I think that the CDC and the federal government have a very challenging job. You want to be transparent, but you also want to be clear. And I think that, for us, and let's just look at West Virginia, in fully vaccinated people, we have only seen a 0.1% vaccine breakthrough rate. That means people fully vaccinated 2 weeks after their final vaccine, we have seen that 99.9% of people in that category do not get reinfected with COVID-19 and do not get sick, do not go into the hospital, do not end up in the ICU, and do not die. In the United States, we know that the average of people who are fully vaccinated going to the hospital, going to the ICU, or dying are less than 0.1%, 0.01%, as I read the CDC data that just came out recently as well. So I think that because you're seeing such a large number of people vaccinated on a pure numbers basis, there may be more people that we're seeing that may have breakthroughs. But on a percent basis, these vaccines are incredibly effective. My goodness, we would have never hoped for anything like this. The flu vaccine is more along the 40-50% range of being able to block people from getting the flu. It does help people from getting as sick. So I think that it's really important, first of all, for people to know these vaccines are incredibly effective, and incredibly safe. For people that do break through, however, they are capable of potentially passing that on to other people based on having the amount of virus in their noses and airways, because that's how you communicate it. And even though they themselves are protected against getting severe infection, hospitalization, ICU admission, or death, which is the reason that everybody, in my opinion, who can be vaccinated should be. But if the very few that get reinfected, they may be able to spread it, which is the reason why the CDC recommended wearing masks, because they don't really want to see vaccinated people get reinfected with COVID either. But if they did, they could spread it to unvaccinated people. And as we've said, over 95 to 99% of people dying in this country from COVID today are unvaccinated, and over 90% of people in the hospital now with COVID today are unvaccinated. So the vaccines are no question clear, to me, very clear, as the single best protection measure and infection control measure, and preventing you from getting sick or dying from COVID and spreading it to people who can, of anything we have in our armamentarium.
Jordan. Look, guys, I've got to say this, and I know I'm gonna get myself in trouble saying this, but I got to say this, I love the fact that we have, we've got great journalists, and Steve and Charles, there are a bunch of great journalists in this state. And we dig, whether it be, Kenny, whomever it may be, Mark, all y'all, but you dig into the data, and I love it, because oftentimes you bring us stuff that we would have missed, just like the copay, at the veterans home, and how we basically could have hurt some of our veterans that have given so much off the chart to all of us in the state of West Virginia. It is amazing the good stuff that you find. But on this issue, let's focus on this, because this is really the good stuff. These vaccines, the federal government, and we've seen the CDC basically follow West Virginia many times. If we reported that exactly that way, we have seen West Virginia lead CDC. In many ways. It's unbelievable. We've seen Dr. Fauci come out and say things like, absolutely you should wear a mask at all times. Absolutely you don't need a mask and everything. And we've seen all these discrepancies. I challenge you. You haven't seen that from us. We have been absolutely, we have really been cautious to never cry wolf. We have. And we've absolutely been right in when we come to you with concern. Now, we have been, we have not jumped out and said, well, we're going to mandate masks, or we're going to mandate everybody to get a shot, get vaccinated. It's a government worker and everything. We have held back and tried to do the right stuff. And to God above, we thank him in every way, because we have been blessed by him to be able to deliver to you the right messages. And believe me, they could have gone the wrong way. But in this, I would only say to you just this. We all know that the vaccines are incredibly effective. And we all know that the chance, and I want you to stay with me, the chance of you being able to infect others if you've been vaccinated is really small. The chance of you getting the Delta variant if you've been vaccinated is really small. Now, we do not need to spend an incredible amount of time. Jim Carrey at one time, was trying to see what kind of chance he had with that beautiful girl, and she told him, maybe 1 in a million, and he said, so you think I got a chance? Well, really and truly, if we spend time on so you think I've got a chance, in this situation, we know the obvious. The obvious is, if you get vaccinated, you can't hardly transmit this, and there's not much of a chance that you're going to get the Delta variant. Bottom line to me is that should be the message from our nation, and it's bounced all over the place. And Stephen, you're splitting the bullseye in my opinion, because the nation has given us absolute inconsistency after inconsistency. I hope we don't do that in West Virginia ever. But I thank you for your question, and I absolutely, I hope that makes as clear as I know how to make it anyway.
All right, thank you, Steve. Next to Alicia Hatcher with WBOY.
Good morning, everyone. Governor, this question is for you, and it's a little off topic. My question is in regards to the flooding that happened on Thursday in Mon County. A lot of people were affected by this flood and lost everything, and they're being told that they have to wait until you declare a state of emergency for them to receive any assistance from FEMA or the United Way. So their biggest question is, what can they do to receive assistance?
Well, we immediately put our emergency management team on it and everything, and they've been on it from the get-go and everything. And I hear you. I hear you. When we have monstrous rains in West Virginia, with our mountains and everything, that we do have situations like this. We're awaiting, their response from the standpoint of, FEMA qualifications and all that. We do not know that as of this moment and everything. And absolutely, we're going to stay on top of it and supply every bit of assistance we possibly can supply. But we're on it and we're working it, and the emergency management people are doing a great job, as they've always done. And I'm going to follow up and make absolutely certain that they do their job, but they'll do it.
All right, thank you, Alicia. Next to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. Hi, panel. It seems like there's some talk about discrepancies in guidance from the CDC, but I kind of want to get directly to, some of the things that they've been putting out over the past couple of days. They're now recommending that everyone wear a face mask in indoor public places, regardless of vaccination status. In any community where there's substantial or high risk transmission, according to their data, that's 60% of the counties in the U.S. Many counties and municipalities are following through with reinstating mask mandates. And if you translate that to West Virginia, that would apply to 38 of the state's 55 counties, according to the CDC's tracking system. I understand that, differs from DHHR's own standards. But given all this information, Governor, and your concerns over the Delta variant that you've expressed for seemingly weeks on now, can you explain your position on holding off on a mask mandate right now? And I'd also like to hear from the public health advisors about the reasoning for not going through with this in this moment. Thank you.
Well, and this gentleman was Dave. Dave, let me just tell you my feelings. My feelings are just this. First of all, we have stayed together as West Virginians, and we've pulled the rope together, and we have 2,949 deaths, and it's a monstrously a big number, but at the same time, it is a very small number compared to all those around us. And West Virginians, we know, are the third oldest and the most vulnerable as far as their sicknesses and everything. And so really and truly, by staying together, it's been monstrously important. I'll promise you that tomorrow, if we mandate masks in all public places and everything, we're going to be fragmenting our population like we can't imagine. But, and in addition to that, we don't need it. We don't need to do it. We absolutely do not need to do that today. But absolutely, always, it should be on the table, should it not, Dave? We have got to continue to monitor. The medical experts will come to me and they will give me recommendations, and they have not recommended we do that. I absolutely do not believe that we need to mandate anything at this point in time. But absolutely, as we go forward, we absolutely need to know that everything's got to be on the table. It has to always be on the table. There is no playbook to this. We all know that. Now, in addition to this, we all know just this, just what I just got through saying. We all know that absolutely, if you're vaccinated, your chances of transmitting this are really small. If you are absolutely vaccinated, your chances of getting this Delta variant are really small. For crying out loud. The state fair is going to be here in 2 weeks. WVU football game or Marshall football game is going to be here just in a matter of a short period of time. All of us want to continue, do we not, to trying to live our life with a level of normalcy. What are you waiting on? What are you waiting on? If we get vaccinated, we will absolutely be able to do exactly that. On a national basis, our government is telling us now we need to start wearing masks, and we need to start doing things that absolutely we do not want to do. All we got to do is get vaccinated. That's all there is to it. It's just waiting there for us and everything. We absolutely know, how deadly this virus can be. You're in a lottery, just like I've said before. You're either in the do it for baby dog lottery and winning stuff and having a good time in everything you do, or you're in this lottery right here that I could absolutely have to come in and read your name. So Dave, I hope that's as clear as I can be. From my standpoint, in my heart, we do not need to mandate anything today, but it should always be on the table. Our medical experts have not come to me and said we need to be doing this now at all. There's all kinds of inconsistencies, that happen on a national scene, and a lot of places are a lot worse off than West Virginia. But I can tell you how we can solve the riddle. All we got to do is get vaccinated.
All right, thanks, Dave. Next to Kelsey Soto with WSAZ.
Good Monday, Governor and team. Governor, a few months ago, I remember joining the daily briefing from Mingo County after spending several hours talking to residents there. One of the more extremely vaccine hesitant counties in the state. I think they're still sitting about 27% and are doing less than 15 vaccines a day, according to the DHHR data. Is there any effort to target or add messaging or ads to these areas, knowing that, Kanawha has one of the higher vaccination rates and just a few counties away, Mingo is really struggling. And then a question for our state health leaders. Can you give us an update on testing? Are we still getting a large enough sample size of the community? I remember when coronavirus first hit our area, we were concerned that we were only testing sick people. And I know a lot of those that are vaccinated now aren't getting tested anymore. So, is that kind of what we're seeing in the numbers, or are you happy and satisfied with the data you're getting?
Well, look, I could go to General Hoyer or go to Dr. Amjad, or whomever, and they could answer this probably maybe even better than I can. But let me just say this. In Mingo County, we do have a very small population that's vaccinated. We absolutely need to target even more than we're already doing. Without any question, from the standpoint of the testing, are you happy? Are you satisfied? Well, I'm not happy, but I am satisfied, that we're doing a good job. Can it be a lot better? Absolutely. The thing that I absolutely just want to hang my hat on is one thing, and it's just this. If we're right about the Delta variant, and I hope and pray that we're not, if we're right, we are right about to be concerned, and we are right to bring it to your attention, and we are right about doing something that's novel beyond belief in the booster shot. We are right about that. But here's the thing, and I truly, really struggle with this, and this is from my heart, and I really, really struggle with it. I don't know how, when somebody's telling you that this thing could be, you could have 1,000 or 1,400 times the amount of spewing of the virus or the Delta variant, and for certain, if you're walking through the crowds of the state fair, you're certain if you're walking through the crowds at a mall, or for certain that you're at a football game that there's people there with the Delta variant and it's floating around all over the place and you haven't been vaccinated. I don't get it. I just don't get it. How you can take that level of chance, because the vaccines we know are incredibly effective. Once you get the vaccine, you're not going to be able to spread it. And once you get the vaccine, the chances of you getting it are awful low. I don't get it. Plus the fact that if you compound this thing with one more thing, and it's just this, we're going back to school. If you've got kids that are older than 12 years old, they're going back to school. And they're going to be around kids, all kinds of kids and everything. And some of those kids, absolutely without any doubt, may not even know it. But if they've got this virus, and it goes all up in the air, 1,000 to 1,400 times as infectious goes out all in the air, or they have that much more of the virus in them, and your kids are right there in the school. And Clay Marsh has said the mask may cut it down to 1,000 times as much, or 500 times as much of the virus that you're expelling. That's all the mask is going to do. Cut it down from 1,000 or 1,400 to 500 or 700 times as much is floating around out there. Now, I don't get it. Your kids need to be vaccinated. You need to be vaccinated. We need to be going and enjoying the state fair. I'm going to enjoy the WVU football games or the Marshall football games. I'm going to do that and everything. Absolutely. I don't know how you do it. I just don't know how you do it if you're not vaccinated. I mean, you're just absolutely asking for it. And so Mingo County needs to really step up and really get going, and needs to get going awfully fast. We're going back to school in Mingo County, just like all of our counties. Absolutely, in Mingo County, that we absolutely have a lot of people that I'm sure are going to be at the state fair and going to be at the football games and whatever it may be. We want you there. We want you there, and we want you to love it and everything. But I don't know how in the world you're going to be taking that level of chance to do it and enjoy it and everything, knowing how infectious this thing is, and it's all around all of us. I don't get it.
All right, thank you, Kelsey. Governor, turn it back to you.
Oh gosh, I didn't mean to go through all that if you were just coming right back to me and everything. But again, thank you everybody for your questions, and I love it. From the standpoint of all your questions, all your thought, all your research. Keep doing it. Keep doing it. Check on us and make sure that double check us and everything, because we absolutely make mistakes, and we'll sure acknowledge those mistakes. But I just end by that. I really hope and pray that this thing surely doesn't get nasty. We've done a great job in West Virginia. We continue to do that job, but daggone, I want rid of reading these deaths, but at the same time, you've honored me with this job, and I'm going to do my job. I'm going to be right here, and I'm going to tell you exactly what's going on. And so go get vaccinated, everybody. It's the right thing to do.
Hi, I'm Dr. David Hess, and I'm a primary care physician in West Virginia, and have been practicing medicine now for nearly 20 years, seeing tens of thousands of adults and children in my career. My patients sometimes ask me if the COVID vaccines are safe. My answer is yes. COVID vaccines are safe. They were first evaluated in tens of thousands of people who volunteered to participate in clinical trials. These clinical trials followed the same thorough safety and efficacy standards that the FDA sets for all vaccines in the United States. Since then, millions of people in the United States and around the world have received COVID-19 vaccines, and the results from the U.S. and global safety monitoring efforts are excellent. There are rigorous systems in place to quickly identify any safety concerns and take action. These monitoring systems provide information that allows public health and medical experts to update the recommendations and guidelines as needed to ensure COVID-19 vaccination is safe. When it comes down to it, COVID-19 vaccines are safe and effective. Vaccinations save lives. That's why I chose to be vaccinated and why I recommend COVID-19 vaccination to my patients and my family. Thanks for tuning in. I'm Dr. David Hess. For more information about COVID-19 vaccines or to find a location near you, visit Vaccinate.wv.gov.
Get your COVID-19 vaccine, and you could win cash prizes, pickup trucks, and college scholarships. It's not too late to enter. Get a shot by Sunday, August 1st, and visit doitforbabydog.wv.gov.